After campaigning for years on a plan of repeal and replace Obamacare, Republicans finally have the means within their grasp to make much of that possible. They control the presidency, the House, and the Senate. The filibuster still poses some potential threats to their plans, but it's also within their means to abolish its widespread use in such a way that they could both repeal the Affordable Care Act and replace it with something of their own design. What would that be? In contrast to what many say, there are Republican plans out there to consider. They're the topic of this week's Healthcare Triage. Given that he is the Speaker of the House, Paul Ryan's A Better Way plan is the most well-known. It maintains the idea of guaranteed issue, requiring insurance companies to issue a health plan to any individual or group regardless of their health. But the plan would allow insurers to charge new beneficiaries whatever they wanted if the individual didn't have continuous coverage. If they maintained continuous coverage, though, people in the same area couldn't be charged more for pre-existing conditions or claims history. This is otherwise known as community rating. If people lose their coverage because of financial hardship or loss of employment, they can also turn to high-risk pools, for which Ryan proposes $25 billion in funding. Ryan's plans would also make significant changes to the way insurance is regulated. The essential health benefits package would be removed, meaning that insurers could make plans much less comprehensive and cheaper. It would also allow insurance companies to charge older people 5 times as much as younger people, as opposed to the current 3-to-1 ratio. Subsidies in the form of tax credits would remain, but these would be based on age instead of income. Finally, Ryan would like to change Medicaid to a block grant program, having states make the hard decisions on who to cover, what to cover, and how to save money. It's expected that a block grants amount would rise more slowly than healthcare spending traditionally has, leading to further cuts down the line. Given Representative Tom Price's nomination by President-elect Trump to head the Department of Health and Human Services, his plan's also getting more notice. He's proposed a bill called the Empowering Patients First Act. It also keeps guaranteed issue, requires continuous coverage for community rating, has tax credits based on age, and relies on high-risk pools for coverage of those with chronic conditions who can't afford insurance. It's much less generous in funding those pools, though, which will limit their ability to provide insurance affordability to those who are ill. Unlike Ryan, though, Price proposes repealing the Medicaid expansion with no replacement whatsoever. Poor people will be eligible for subsidies based on their age, but that would likely not be enough to afford private insurance. Senator Orrin Hatch and colleagues have proposed the Patient Care Act, which is similar to Ryan's with respect to Medicaid. It also keeps in place community ratings as long as people maintain continuous coverage. It increases the age bands to a 5-to-1 ratio and allows for much less comprehensive coverage. The CARE Act differs from Speaker Ryan's plan in that it has higher subsidies for the poor and a form of a mandate. It automatically enrolls people into cheap plans covered by subsidies. Senator Ted Cruz has introduced the Healthcare Choice Act. Interestingly, this proposal leaves the Medicaid expansion intact. It does, however, completely dismantle the insurance exchanges. There would no longer be a mandate, no guaranteed issue, no community rating, and no subsidies. He'd also push for insurance to be sold across state lines, a proposal that often appeals to those in the campaign trail, but which is problematic and would likely fail to improve people's ability to obtain care at a local level, as we've discussed many times. President-elect Trump also has a plan, which we've covered in previous episodes, and it's much less comprehensive than most others. As of now, it's a few paragraphs long and nods towards ideas seen in other plans, including increased use of health savings accounts, high-risk pools, selling insurance across state lines, and giving states more flexibility with Medicaid. In contrast, 2 plans from conservative think tanks are very comprehensive. The first is the American Enterprise Institute's Improving Health and Healthcare, an Agenda for Reform. Like Ryan's plan and others, it would also get rid of essential benefits to allow for more flexibility in what plans are offered. Like the Patient Care Act, it would automatically enroll people in low-cost plans if they didn't sign up on their own. It also moves Medicaid to a block grant program. It would, however, retain much of the insurance exchanges as a means for people to buy plans. Finally, Avik Roy, now of the Foundation for Research on Equal Opportunity, has a plan he calls Transcending Obamacare. It calls for the widest age bands of any plans at 6-to-1, which would make insurance cheaper for the young and more expensive for the near elderly. Unlike other plans, though, it keeps subsidies tied to income, not age. Instead of continuous coverage requirements, it proposes to induce healthy people to enter the market by holding open enrollment every 2 years instead of every year. It's important to stress that there are many similarities in these plans. Most of them are based on the belief that requiring insurance to be comprehensive, essential benefits, makes insurance too expensive. Their architects argue that many want to buy less comprehensive catastrophic plans. These plans also embrace the notion that there should be more of a difference between the cost to a younger and older beneficiary. They all oppose the mandate in its current form as well. Differences between them, though, expose major areas of disagreement. How much should people get in subsidies to help them purchase insurance? And should those be tied to age or income? How much of a tax break should people get for buying health insurance? What should we do with Medicaid? Should people with pre-existing conditions be charged more? Should there be a mandate in some form? And if so, what should it look like? And how will we pay for all this? Republicans have been discussing replace for 6 years. Now, they may choose to move from the abstract to the specific. Merging these plans into a law will require much compromise, though, and hard choices. Healthcare Triage is supported in part by viewers like you through patreon.com, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank our research associate Joe Sevitz and thank our Surgeon Admiral Sam. More information can be found at patreon.com/healthcaretriage.